The Digital Health Voice podcast is brought to you by MedTech World in collaboration with Digital Health Malta. Episode number 24. Today we're going all the way to Hungary, where we will be meeting with Fruzsina Mezei. Fruzsina is a digital health consultant, health economist, and even more interestingly, she is a PhD candidate at 𝐿𝐕𝐲𝐬𝐻 University. And with that in mind, let's dive deep into the interview. Hello, Fruzsina. It's such a pleasure to have you with us today. As you know, I always like to start the podcast with a bit of like dish, and the audience seems to enjoy it. But we have met before, Fruzsina, and we're really lucky to have met at the European Health Forum 𝐂𝐿𝐴, which was a fantastic experience. We also met at HIMSS Europe, and you've always struck me as someone who is really spot on, and really focused on your work. But my big question to you is what's your digital health journey? How did you end up on a digital health podcast? What really brought you here?
First of all, thank you so much, Stefan, for having me on this podcast. I've actually been following your previous podcast, so it's really a pleasure to be speaking to you here on this episode, on this podcast. So my story, my background, it actually goes back to when I was a kid. As both my parents, they are in the medical device industry. So I learned the importance of healthcare and proper healthcare delivery quite early on. So I decided to study to become a health policy analyst. And I started to work in the beginning of my career for the National Public Health Institute of Hungary. Mm-hmm. Where I was working on developing and improving primary care protocols for chronic diseases like diabetes, hypertension, mental diseases, oncological diseases, and even some musculoskeletal diseases. And while doing that, I noticed quite early on that the adoption of innovative solutions in healthcare is lagging behind. It's quite difficult to actually get innovative solutions to be used in healthcare delivery. So I started to wonder why. And being a young professional back then, I was also super interested in thinking about solutions to problems. How can we solve structural issues in healthcare? So I started to attend hackathons, and I think that was actually where we met the first time as well.
Yes, that's true. I kind of forget about the hackathon, and I know, I have to admit here, Fruzsina, this is something I like. I remember the competitive spirit. I loved it. And both of us had it, so I was like, okay, and then you can see it there, and it's so pleasant because. Even the fact that there is a competitive spirit in digital health and also wanting to find a solution, that's great because it kind of brings about, the passion of different people. And I could really identify that in that specific event, and I could see that it has persisted all along. So tell us even more about after the hackathon, what happened then?
Yeah, so I was quite involved with the entire startup ecosystem and innovation in healthcare, and I wanted to bring these two things, so the public health and innovative aspects of digital health together, and I found it quite difficult. And while I was at the National Public Health Institute working, I also pursued the master's in health economics, and that kind of became the link for me between the two, and it turned out to be really interesting because I found that the evidence-based evaluation of new health technologies is of utter importance. So I think that's one of the key solutions to actually get innovation and digital health solutions implemented in healthcare practices. So the synergy between these two great interests of mine, digital health and health economics, kind of became the focus of my work now. And I'm lucky enough to say that I'm currently a health economist and a digital health consultant at EIT Health. And I'm leading a large-scale European task force on harmonization of evaluation of digital medical devices. And I'm also a PhD candidate at 𝐿𝐵𝐸𝐻 University, pursuing new concepts and methodologies for the health economic evaluation of digital health solutions.
Boom! Wow, you're doing so many things. I'm gonna explode. But you really intrigued me because you mentioned. I'm not sure if you can tell us more a bit about the work you're doing on the task force, if you can, of course. And it would be really cool if you can give us maybe a hint on what you're researching about. I know that sometimes it takes time to talk about the academic work, but if you can maybe give us a hint, or even possibly you can, if you want people to collaborate with you, this is the place to do it. So I'd love to hear a bit more about those last two things. That's really, 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 really interesting. Tell us more.
Absolutely, and I think it's the perfect time for me to be on this podcast because we have just started to disseminate the work of this European task force. So, wow. Of course, I can tell you more about what we are doing. The task force has been launched in April 2022, so a couple of months ago. Under the digital health agenda of the French presidency of the Council of the European Union. And it basically builds on preparatory discussions around the Digital Healthcare Act that has been launched in Germany in 2019, which is more known as apps on prescription, or where doctors are able to prescribe digital health apps to their patients since the beginning of 2020, and some other European countries are planning a very similar regulation framework. For example, France, Luxembourg. There is already one in place in Belgium, but many countries, many European countries, are thinking about how to pursue this kind of apps on prescription mentality, and also put it on paper so that it's regulated. And this task force that I'm currently coordinating is actually constituted of 20 members. Representing representing the academic sector, the public policymakers, and also several national competent authorities from countries like Austria, Belgium, Italy, Finland, Luxembourg, Spain, among others, and the vision of this task force was basically to accelerate the digital transformation of medicine by integrating technologies with an evidence-based clinical benefit into healthcare procedures. And I like to emphasize this because it's really important that these technologies that we'd like to accelerate and put into patients' hands, these are proved and assessed. So it's an evidence-based assessment that they go through. And obviously with the ultimate goal to increase access for patients and improve healthcare. So this is something that Germany has already done. it's kind of they did it on a trial error basis, so they're still improving their regulation. But many countries are looking into this, and this European task force is trying to provide a harmonized framework, some suggestions how countries can do can put such a regulation in place that's not completely unsimilar to each other. So we are looking to harmonize these frameworks because it would also benefit technology developers to disseminate their technologies and their solutions across borders.
Wow. So let me put it like in a very practical term. That means if a country, for example, like Malta, who would like to set up their regulatory framework, and also they want to set up their assessment methodology and possibly maybe the authority that they would have to set up, or who will be the regulator, these documents that will be coming out will help a country like Malta to get started. Is that the case?
Exactly, that's correct. And that's exactly our goal.
Wow. Okay, great. So I can't wait, first of all, to start reading this document, start poring over them and start getting the gist of it. I also have the opportunity to work, on these topics, especially on digital therapeutics. So really there is a lot of opportunity there for sure. And I'm really happy that you are working on this, Fruzsina. But let's be practical. How do you work with healthcare organizations and health professionals to communicate this work? Like, so let's say a doctor comes to you, it might be me or it might be someone else, say like, but what is the value of all this work that you're doing on, like, how will it change the way I work? And maybe in a practical way, in a language that possibly they can understand. Or even a hospital manager, how would you communicate it to them, like to convince them that this is really worthwhile work that you're doing? How do you get them on your side, Fruzsina?
I think this is a really important question, and especially because I'm so involved with the regulational aspects of this entire work that sometimes me and my colleagues and the entire sector tends to forget about how important actually social acceptance is, and how important it is for people, for patients, for healthcare providers to understand why we do what we do. And I think a great example for this is actually what happened in Germany with the whole Digital Healthcare Act, is that regulation has been put in place which allowed for prescription of various already assessed digital health applications. But after a year or so, barely any applications have been prescribed by doctors. And decision makers have started to think about why that is. And they realize that they haven't put enough emphasis on social acceptance and education of healthcare providers, of patients, and haven't actually managed to convince them why using digital health apps would be good for them, why they should prescribe them, and how this can help patients heal. So I think this is a super important question, and we have also dedicated a work package within this European task force just for this, because I think we really need to emphasize how we integrate digital health solutions and innovative MedTech solutions into healthcare delivery. And therefore, as I said, there is a work package that emphasizes healthcare system integration and also the socioeconomic requirements that are needed for digital health solutions to be actually used. And I think this small story or example actually indicates very well that it's not always the regulatory side that's very challenging, but we need to really take care about how people, individuals view what we are doing. So work package 3 actually starts within this task force in late September. And I'm very much hoping that I can share the results and the suggestions with you by approximately by November in form of a consensus paper that will be signed by all of the countries I just listed before.
Wow. All right. That's really, really amazing. Like one amazing thing after another, Fruzsina. That's really great. So we have some opportunity because, believe it or not, we're coming to the end or close to the end of our podcast. We're not there yet, but we're getting there. And I have like one moment for you where you can do some blue sky thinking, so to speak. So in your opinion, what does the future look like for digital health and MedTech, and maybe even digital therapeutics in your case? Like, how do you see yourself, let's say in 5-10 years, or how do you see us using digital health?
Very, very interesting question, because I have a lot of lots of interesting ideas, and I really hope that they will all happen, or at least some of them will come true. Okay. But I think that digital health and MedTech in the future has a huge potential. It already has a great potential, but all the developments that have been happening in the last couple of years point towards a very, very, very promising future, a key role in healthcare delivery. Digital health can change the way healthcare is delivered and also thought about completely just by adopting some very small changes. If you think about adopting digital health apps, for example, so applications in the care pathways, just imagine what kind of change that brings already. It will be a hybrid care. It will be a hybrid care practice that shares work between the actual digital health apps, but the healthcare providers. So it's a completely different care pathway that also needs to be adopted by the healthcare professionals, the patients, but technology developers also need to be prepared for the role that they will take in this entire process. So I think that the care pathway will change completely in the next couple of years, and if not completely, it's definitely an iterative way of change, because luckily we can always take a step back or maybe move a bit faster if we need to when it comes to changing the care pathway of different diseases. I think this hybrid form of care will also take up in many different disease groups, but in some, the classic pathway will remain. So I think one of these fields is, for example, mental health, that definitely has the potential to move towards hybrid care. But of course, there will be many disease areas where the classic care pathway will stay. So I think ultimately the future of digital health and MedTech innovation is very, very promising, but we need to be prepared for the change, and we also need to emphasize healthcare system integration and social acceptance of these.
Wow. So like if I have some keywords, especially from this very interesting conversation, I was thinking of social acceptance, and care pathways, healthcare systems integration, like really all really important stuff. But moving away from digital health and healthcare, I would like to give you 1 minute now. This is like our special moment here in the podcast. I'd like to give you 1 minute to raise awareness on any topic of your choice. It doesn't have to be healthcare. It can be anything that you wish to raise awareness on. And with that in mind, the 1 minute starts now.
So it doesn't have to be on healthcare?
No, it doesn't have to be on healthcare. It can be anything that you wish.
Okay, so if it doesn't have to be healthcare related, I think I would go with climate change, actually, because I find it increasingly important that that people and decision makers in particular pay attention to warnings and also predictions about climate change. And being summer now, and so many countries experiencing heat waves, water shortages, this will only get worse. And not to mention the effect that climate change will have on health and healthcare, with all the health-related illnesses and death, like increasing number of cardiovascular diseases, pulmonary diseases, infections, etc. I feel like there is also an analogy between taking care of your health and the climate, because both actions have an effect in the future that might not be visible immediately, and therefore it's not very attractive for people to take change, because they cannot see its immediate effect. And I think that, as said, many countries are experiencing very severe effects of climate change currently, as it's the middle of summer in most countries, and there are so many things that can be done as an individual to try to mitigate the effects of climate change. And actually, the European Institute of Innovation and Technology, where I work in the health division, also has a climate division. So I urge everyone to check this out as well.
Well, that was really close to 1 minute, so fantastic work there, Fruzsina. With that in mind, I'd like to invite all our listeners to find us on your favorite podcast player. We're pretty much everywhere: Pocket Cast, Google Podcasts, Apple Podcasts, you name it. You can find us there. And you can even find us on the socials of MedTech World, which is the yearly conference that is organized on Malta on digital health and MedTech. We even have dates. Check out our website there. And with that in mind, I thank you, Fruzsina, and I hope to see you around at some conference.
Same here, Stefan. Thank you so much.